Welcome everyone who is joining us today. This is episode 17 of Techcyte's Pioneers in Digital Pathology series of webinars. It's a reduced time format that we have adopted in sharing information about the industry and our company and products, and we're happy to have you with us today. But before we get started, just a few housekeeping items. We have a question and answer session at the end, and to ask questions throughout the entire presentation, you can send us chat messages. And at the end, when we get to the Q&A, we will be able to address any questions that you have. My name is Troy Bankhead. I'm the VP of Marketing for Techcyte. I also run the European office, and I'm actually located in Luxembourg. And we are pleased to have Dr. Tiffany Chen, who is our Chief Medical Officer at Techcyte, joining us, and she will be actually giving us the presentation. So really briefly, today we're going to cover a brief overview of Techcyte, and then Tiffany's going to go into Fusion, the platform, and then our core subject for today, which is the frozen section suite that is on the Fusion platform. And at the end, we'll have a Q&A session. So Techcyte was founded in 2013, and it all started with a white paper that posited that you could use AI in certain laboratory tests. And ever since then, we've been specializing in the clinical pathology realm, simply because strategically that was a place where we felt that we could make the biggest impact, because not a lot of people had been attacking that side of the laboratory's problems. However, you'll notice on this slide that we've got two other verticals, veterinarian and environmental. Now, environmental is, it started off as a side project because it uses, home inspectors use the same technology that we use in the laboratory just for looking for air particulates. And so for air quality, we developed a whole service that the air quality industry uses today. And veterinarian, we focused on that early on because it allowed us to prove out not only the technology, but to scale the technology with a partnership that we made with a company called Zoetis, which is one of the world leaders in animal diagnostics. And so it allowed us to really grow the company. And of course, our core specialty is the human with anatomic pathology and clinical pathology. We are the only platform that joins the two sides of the lab, enabling one platform to service both of them. As a company, we go well beyond just the AI. The platform itself serves many purposes, and I'll let Tiffany go more into that. And our strategy today is to partner with key players in the industry, whether it be ARUP or Mayo Clinic, to help us develop the models that we then bring to the market. We're located in Utah, that's our headquarters, and our European offices, as I mentioned earlier, are in Luxembourg. We're over 150 team members today, and we're scaling very nicely throughout the world. So growing nicely and healthily as a company. And without further ado, I'd like to turn the microphone over to Dr. Chen for a more in-depth presentation of Techcyte Fusion. So Tiffany, take it away.
Thanks so much, Troy. Let me just take over this presentation. So good afternoon, everyone. I'm really excited to walk you through how Techcyte is transforming frozen section workflows with our frozen section suite. But before we dive into the suite itself, I'd like to start with a quick overview of our Fusion digital pathology platform, since the frozen section suite is a solution that is built within it. So Fusion is our cloud-based digital pathology platform. We're able to support pathologists, trainees, scan techs, and other lab professionals, as well as other non-pathology stakeholders. So today we'll talk about like doctors, as well as lab admins, with these different use cases like AP, CP, and for today, we're talking about frozen section. So we'll support whole slide images from various scanners. We do have a preference for DICOM, and we deeply integrate in with your EHR, your LIS, and your PAC systems using open standards like HL7, FHIR, and DICOM Web. So our platform is flexible and highly customizable, so pathologists can really personalize their work list with filters, priorities, and groups to suit their different workflows, like the different subspecialty workflows and even the frozen section workflow as well. We're even able to support users across different setups. So whether you're a single monitor setup to multi-monitor setup, Fusion can be flexible for that. So our Fusion viewer is ultra fast, and we're able to support things like annotations, measurements, and viewing all kinds of image types and image stains from H&E to IHC and special stains, as well as things like electron microscopy and immunofluorescence images. So we also allow for collaboration and image sharing, so for second opinions or even for training purposes. And we'll have in-app communication, so like pathologist to pathologist, pathologist to trainees, pathologists to scan tags or admins, and even pathologists to the OR, which is a core part of what I'll be showing you today. So for Fusion, we have an open API, so we're able to plug in and connect with third-party or even homebrew or homegrown AI. And we also have our own native Techcyte AI algorithms that we have for workflow and diagnostic purposes. So in terms of reporting, we do support all the CAP synoptic templates. So we have all of that already within our system, but we also support free text reporting as well as dictation and any customizable institutional templates, macros, shorthand, hotkeys. And then for today, we're going to be talking about specialized frozen section reporting. And we have a request system that is quite robust, and it's built for not only consults and secondary opinions or secondary reads, but also depending on our level of integration with your LIS, we can support more of a PACS-driven workflow where you can order things like recuts, stains, levels directly within our system, and we can communicate with your LIS to drive that. So this really sets the stage for how we plan to handle one of the most time-sensitive and collaborative workflows in pathology, and that is frozen sections. So now we're going to move towards our frozen section Fusion suite. So let's briefly review first how frozen sections typically work. So what happens is that the surgeon will then collect a specimen intraoperatively while the patient is still under anesthesia. So that specimen is then transported to the frozen section lab where it's then accessioned, frozen, cut, and stained. And ultimately, the slides get to a pathologist who evaluates it, generates a prelim diagnosis or margin assessment, and then they pick up the phone, they call the OR, and usually through the phone or through intercom will relay the findings. So this process, again, is really critical for the surgeon as they are trying to decide what they want to do next. So for the surgeons, they're either wondering, is this specimen is it a tumor? Is it cancer? Is it infectious? But they also want to know, are my margins positive? Did I get everything out? So as you can imagine, these are high stakes scenarios, and there's always a lot of time pressure there. So because there's so many different components to this, from the OR to the lab, so many different players and factors, you can imagine that there are many challenges that are associated with the current practice of frozen section. So a big one really is time pressure. So per CAP guidelines, the recommendation is to return a single block within 20 minutes. And that 20 minutes goes really quickly. So that includes time from accessioning, grossing, freezing, staining, and then reading it. And then if a pathologist needs a secondary opinion, that can add time as well, because that's time you need to page another pathologist or email or call them, wait for them to come down, and then share the case to get that second opinion. You can imagine there could be communication delays as well. So phone calls can be missed, callback times can be hard to track. When you're speaking through an intercom, it can be difficult to really get clear communication. So there's often times where the OR may be asking the lab to repeat, and there's no good way to really track what has already been communicated. And then there's also coordination issues. So frozen sections are really the first part of a patient's diagnostic journey. So the frozen section specimen will then, further on get processed and fixed and then turn into permanent slides, which can come a few days later. So then matching together that frozen and permanent slides a few days later can be cumbersome, but you can also imagine that it could lead to some errors there and also some potential for lost slides. There's also limited access issues, so especially with increased staffing shortages. Sometimes pathologists are covering multiple sites. Sometimes they're not present in the frozen lab, so they have to commute every time a frozen section is completed. And while a lot of times frozen sections are scheduled, there are cases many times when these frozen sections are emergencies in the middle of the night, and you have no choice but to always be on the lookout and have to drive 30-40 minutes in just to see the frozen section. So that means getting a pathologist physically there, it can be quite difficult and quite limiting. And the same thing with getting a second opinion. Again, if your pathologist that you're getting a second opinion is not located nearby, that can take some time as well. And then lastly, I want to talk a little bit about documentation gaps. So being able to, maintain that call log has been really manual. And then tracking these turnaround times aren't always consistent or complete. And from a lab administration standpoint, those things are really important, especially for audits. So there are a lot of issues currently in frozen section. It's a practice that has been going on for a while and has been picking up more and more speed just because surgeons and pathologists have found this extremely useful in driving decision making in the OR. So for us, we really wanted to tackle these challenges, and that's why we put a lot of thought and effort into developing this frozen section suite, which is a comprehensive and digitized solution that will not only provide a comprehensive frozen section workflow solution for the lab, but also connects the OR and the frozen section lab in real time. So for the frozen section suite, from the moment a specimen is received, it gets digitally accessioned and then assigned to a pathologist. And then the OR will get a live view of the case status, and they'll receive real-time updates as the lab processes the specimen. So then for the pathologists, they get to view the slide digitally within our Fusion viewer, our ultrafast viewer, and then they can use things like our built-in tools like annotation and measurements. And if there are any AI, they can use that as well to help them evaluate the case. They can also really tap into our Fusion features, and be able to use things like our request system and ask for second opinions or a consult with a subspecialist who may not even be present. So all of that can be captured within our system, and we do have in-app notification systems to allow all pathologists who are within our system to get notified every time a request or a consultation is made of them. And we also have other types of in-app communication, so through our in-app comments that you can tag colleagues for input, but also allow pathologists and the lab and the OR to communicate. So I'll be showing that right after this. So lastly, I also wanted to talk about within our Fusion Frozen Section suite, because we tap into the features that's already within Fusion, the user can then access clinical context. So that's really important when it comes to frozen section, because you oftentimes need to know, like, what are we looking for? What is the patient's clinical history? Have there been prior path or prior radiology? So all of that lives within our history tab within Fusion. And again, our history tab is a view where the pathologist can see all the patient information coming from that patient's EHR. And that really limits the number of applications the pathologist will need to have open at any given time. So this is just an overview of what I just described with the digital case review. So the pathologist will then receive these digital slides, submit their specialized frozen template reports, and then give a real-time update to the OR. So the OR will then receive the pathologist updates. They can communicate back and forth with the pathologist. And then lastly, once it's all been resolved and everything has been called back, the slides are then archived and easily retrievable for when the permanent slides come out and you need to compile the case back together for permanent review. So this will really resolve the case, the patient's different encounters into a singular comprehensive view of the patient's case. So some main things just to review, we have easy access to patient information through our EHR integration. A lot of times doing frozens, grossing happens and you can take frozen images. We will be able to support the ability to store those gross descriptions and gross images directly within our system. We have very intuitive preliminary reporting, which I'll show next, which comes with specialized prelim diagnostic reporting boxes, as well as margin assessment templates. So these are margin assessment tables that you can easily select different margins and call them positive, negative, or even something that is more specialized, like negative but close within 1 millimeter. We do log all the callbacks times so that you can have a good way to audit these. And then we're now enabling remote reads and subspecialty consults. And then this helps, a lab fully transition to digital pathology. So if they are already digital on permanent section, they can now have a very complete view of a patient's case from frozen sections to permanence. You might be wondering, how are we getting these images in? So right now we support Pramana and Grundium's whole slide scanners. So these are the two scanners that have been shown to be able to have quick scanning and upload times for frozen section time restrictions. And then lastly, we've been able to integrate with Epic's OpTime. So that's like the surgical scheduling tool that the OR uses. So then we can pull in the information of the patient as it comes through OpTime. So then the lab can have a sense of, which patients are up for surgery and could be sending potential frozen sections that day. So like all in all, what we have here is an integrated and real-time digital workflow. We have different interfaces depending whether you're a pathologist in the lab, frozen section lab, or if you're a surgeon within the operating room. So now let me just show what this actually looks like for the pathologist. So when the pathologist goes in, they have their work list. So our work list is, again, very flexible and configurable. So right now in this view here, I have it set up so that you can see all the frozen section cases that are coming into the practice. So we know that pathologists aren't always on a dedicated frozen section service, and they may be signing out multiple subspecialties that day or cross-covering things like breast and frozen section. So we have a way to smart filter out all the frozen section cases, as you can see on the left-hand side. And this shows you that you have cases that are frozen within frozen section. It also shows you which cases have already been called back and which cases are still pending a callback. So you can go directly to those cases that need your attention. So then within the work list, you also see things like OR number. You also see surgeon name. So because we integrate in with OpTime, we can pull in that information. And this can give you a good look as well into what type of case is coming. And typically, like based off of the surgeon who's submitting it, what they might be looking for, or what types of specimens, whether it's a cancer case because it's an oncology surgeon or an infectious case. So this gives you some context into what cases are coming here. So we also have a visual indicator that shows you that this case is frozen. So if you're not in a filtered view, you can still easily identify within your work list based off of looking at this exclamation point icon, and this can help you triage your cases. So here again, this is the OR number and the surgeon, and all of these are within your work list and within a saved view, so that this information surfaces when you're looking at frozen section work list. But if you were to switch to your breast work list or a different saved view, you could have your columns arranged to the columns that match that workflow. So then once the pathologist clicks into the slide, into the case, they see the digitized slide through our slide viewer here. So this is our main slide viewer or case viewer within Fusion. You see our classic Fusion components, like we have our slide tray off to the left. We also have multiple tabs up top. So right now this is the main slide viewer, but you can also view the clinical history as well as any other things like gross reports and gross images. So within our slide viewer, they get to tap into all of our built-in tools like rotation, annotation, measurements, and then this is where they'll be able to do their specialized reporting. So right now here you have the frozen section panel open for reporting, and you'll see within our reporting box, you'll have the ability to give the specimen descriptions, give a preliminary result, and also give margin assessments. So our margin assessments are laid out in an easy to access way that is a table. So you can add in different margins, whether it's a lateral margin or a medial margin, or even whatever margin that is unique to your case. You can type that in, and then you can select positive or negative and also select the source, because sometimes you want to give a gross assessment or a gross margin, and sometimes you want to give a microscopic margin. So once you have completed your evaluation, you can call back or publish your results over to the OR. And then within the OR, this is the view that they get. So the OR here, as you can see, they see the case in different parts as well. You have parts A, B, and C. So within here, they get to read the preliminary results. It comes in a big text block here. And they also get to see the different margin assessments. They see the margin table. And these will allow clear communication, because now this lives within their screen. And if there are any updates that happen here, the updates will then get published. And you'll see that there's a blue bell icon. So this will give them both a visual and audio notification that there are results that have been published or updated, so that the OR can then always make sure that they have the most up-to-date communication and updates from the lab. We also have the ability to have comments, or this is kind of like an informal chat between the OR and the lab. So the surgeons or whoever in the OR can send messages such as like sending 3 more margins, and then the lab will then get a notification in-app that comments have been left, and they can reply with something like margins received, currently freezing. So then these messages are logged and notified in real time. So lastly, I just wanted to summarize just some of the main key benefits that comes with our frozen section suite. So we know that for Fusion Frozen Section, this will now enable remote consultations. It will expand access to subspecialty expertise as well. We can then improve collaboration and that communication that happens across labs and surgical teams, and this can really help strengthen the relationship between the two departments. So we'll be able to support real-time digital reporting and audit trails. And this can also help lab scale across different sites. So, as we do have a resource shortage, pathologists may find themselves covering multiple labs, multiple hospitals, and increase their service capacity. So now they can do that remotely, and that could also drive revenue growth for labs as well. And then this can drive workflow digitization from the very start of a patient's case. You can now, do better case management and combine the patient's frozen section slides with their permanent slides very easily, keeping everything all together. So really, by connecting all these different stakeholders from pathologists, trainees, lab staff, and surgeons, Fusion can really help ensure that the frozen section workflow is fast, confident, and very well documented. So like frozen sections, like I mentioned, are often the first step in a patient's diagnostic journey. So with the Fusion Frozen Section Suite, we help ensure that this first step is clear, it's collaborative, and it's fully integrated into a digital pathology workflow and a digital pathology future. So we believe that this solution adds meaningful value, not just for pathologists, but for pathologists and for surgeons, and ultimately for patient outcomes. So I'm just going to end it here. So if there are any questions, I would love to answer them. But thank you so much for all of your time today.
Wonderful. Thank you so much, Dr. Chen, for that presentation on our Fusion Frozen Section Suite. As we mentioned, we would now like to have a Q&A session. We've already got some questions from our attendees. The first question comes from Gary, who asks, do they require a report? Tiffany, are you able to address that?
I guess I'm not quite sure exactly who they is referring to, but I would say you don't have to publish a report if you don't want to. You can use it as a viewer. You can use it to manage your frozen slides with the permanent slides to make sure that they stay together. The reporting feature is just, I wouldn't say it's mandatory, but it is there for your convenience if you do want to do specialized reporting within the system. But otherwise, you can definitely, upload and view your frozen section slides. You can annotate. You can make sure that your frozen section slides stay with your permanent slides. So I still see a lot of advantages there, even if you don't use the reporting feature.
Thanks. We've got another question from Sharon, who asks, what does onboarding look like for a lab wanting to go digital with frozen sections?
Yes, so that's a great question. So if a lab is wanting to go digital for frozen sections, this will be similar to like a discussion on just a lab going digital in general. So you will have to look at what scanners best fit your current workflow and your volumes. And then for us, once we've identified your, what types of volume you have, what types of scanners you would prefer, then we can set this up to start. Because we're web-based, it's pretty easy to just log in and start. But I would say a lot of it first comes from, the IT and infrastructure standpoint that comes with any digital journey.
Indeed. Michael asks, are there any specific scanner or LIS integrations required to make this workflow successful?
No, that's a great question. Yeah. So for us, we believe that we'll support any scanner that works well for this workflow. We've identified so far that, Promana and Grundium scanners generally do quite well for the frozen section workflow, but we are open to, other scanners as well. We do have a preference for DICOM file formats, but, we also support other more unique file formats as long as they can be converted to DICOM. In terms of LIS, we're flexible. We're flexible for integrations with different LISs. We're standards based, so as long as we can communicate through HL7 messaging with your LIS, that shouldn't be an issue.
Thanks. Ryan asks, is there a specific threshold of volumes that makes your your digital frozen section worthwhile?
I'm a firm believer that even like the lowest volume, if you do one a day, it still makes it worthwhile, just because one, you're just improving that relationship and communication with the OR. So you have a well-documented way of communicating now with the OR, and I think that alone is very important. And I also think that this, for pathologists that don't do a lot of frozen sections, they might not want to commute to the lab every day. And I think a lot of pathologists live further away from the institution. So for the off case that they're covering frozens, this can really help them not have to physically be there by enabling remote review. So I think there's still a lot of value to low volume labs and low volume hospitals and labs as well.
Thanks. We have another question from Cindy, who asks, how does Techcyte manage live viewing and collaboration between multiple users during a frozen case?
Yes, that's a great question. I didn't get a chance to show this today, but if you're interested in looking at our in-app collaboration tools, we do have a prior Fusion webinar that I've done before. But basically, we have a digital like multi-headed microscope view where you'll have the ability to have multiple users on at any given time. They can view the slide together. You can pass back and forth presentation, almost like, changing seats in a multi-headed scope. And this can help, drive more collaboration. And then we have our comment box there, which allows users to then chat and communicate. And we're also in the process of integrating with Microsoft Teams. So you can imagine that will allow for better communication too. If you're viewing the cases together, but remotely, there could be a way to connect with an audio chat as well.
Thanks. Dale asked, can you use the frozen section viewer even if you don't scan the slides? And then we had a secondary similar question. If we don't scan our frozen sections, can we use the platform for communication anyway?
Definitely. So you don't have to scan the slides in. We know that, there's maybe more obstacles to getting, scanners and all of that in first. So, but we think that there's still so much value in that communication piece. So you don't necessarily have to scan the slides first and have a dedicated scanner. You can use it purely for the ability to communicate with the OR and have specialized reporting. And also, if you're digital, on permanence or on your other workflows, what you can do then is, scan in your frozen slides later after the fact and then upload them in so you can, then consolidate the case. So we believe, having that case management, being able to unify a case is very valuable. So you don't need to have immediate frozen scanning to do so. And that communication piece, I can't emphasize enough, like how much importance that has to both the lab and to the OR, that for me, like, I believe that drives so much value already without having to scan in.
Thanks. Ellis asks, how does Techcyte charge for the viewer? That's a bit more business question.
Yeah, that might be a little bit more complicated of a question. If you're interested, we can definitely set you up with someone from our sales team. It's a little bit more nuanced because we need to understand like what exactly you're looking for in a viewer, what your slide volumes are, and then we can come up with a more dedicated quote then.
And Kelly asks, what happens if there's a network issue mid-case? Is there offline access or a fallback process?
Yeah, no, that's a good question. I feel like that, it's always very relevant in our modern era of technology. But, I think for frozen section, because what we're doing here is specialized reporting and we're giving another way of communication, that doesn't take away from the original means of communication. So you can still, call back to the OR, how you've been calling back, and then log it retrospectively. So it doesn't take away from existing practices, but it does. But yeah, I think that just comes with the nature of, technology. If there's some network issues, thankfully there's the fallback of doing it manually.
And Stephen asks, for labs evaluating budget, what are the most compelling financial or patient care metrics to justify investing in this for frozen section?
Yes. Oh, yeah, that's a great question. Everyone, is always really interested, like, what is the ROI? And some things are not as easily measurable, like, improving relationship between the OR and the lab. From what we've seen so far and customers that we've talked to, this is actually really, really beneficial for the OR. So typically we see the OR is driving, to get this implemented in. And that will drive patient care for them because, as the patient is there and lying open, it just minimizes any risk of, miscommunication, delays. So there's a lot of value there. And we've seen that, if you work together with your OR or your surgery department, you can really drive this to get adopted quickly by the institution.
For sure. Yeah. Between reduced pathologist idle time, fewer repeat procedures, optimized use of the subspecialties,
Yes.
Decreased slide transport costs, faster decisions in the OR.
Yeah, and then I think I also mentioned in one of the slides is that you can really drive more revenue growth. So as a pathologist group, if you're covering multiple hospital sites, you can now expand that and cover even more if you're able to review, your frozen sections remotely as well.
Thanks. Sun asked, have you compared the performance of turnaround time, the TAT for frozen section, between traditional processes and the digitized process?
Yeah, no, that's a great question. So right now we're piloting this, so we should have results to share very soon.
Yep. And Laurel has asked, how long are images available? Is there an archive process?
Yeah, so that's also a great question. And I think that's highly dependent on, the sites. We can have images available for as long as you need. That's just part of the part of the discussion that we'll have with you for each of the sites. Different labs have different times that they want to keep their images live in hot storage. So it really depends. But we can support whatever time frame. Some places, only want things for 30 days. Some places want 50 days. Some people want a little bit longer.
Indeed. Bruce asks, does the system produce an actual report that gets documented into the surgical report documentation?
So yeah, so this frozen section report will then get saved within our system. And then from there, it just depends on the level of integration that you're doing your final reporting. So say you're able to do final reporting within our system, or you want to do final reporting within our system, we can pull in the frozen section report and merge it together so that it is living within your surgical pathology report. So if the frozen section report is in there and you're doing all final reporting within your LIS, we can also send that report to your LIS, or you can copy it into your LIS as well.
Thanks. And Sean has asked, does this reduce the amount of recuts?
Yeah, I mean, that's a great question. I think that's something that we'll have to see as we continue to pilot this, since this is a new product and we definitely want to compare it with a traditional process. In terms of recuts, it's still difficult to say because, when you scan a slide, you're still dealing with the same issues of like tissue folding if it's already there on the glass slide. So we'll really have to see in our pilot study what happens then. Yeah.
Indeed. Okay, well, we've exhausted the time that we normally allot for these webinars. And so with that, I would like to thank each and every one of you who has joined us on this presentation today. All of you who have attended will receive an email shortly after this so that you can review the recording. And by all means, if you have any questions, please reach out to us at sales@techcyte.com. Thanks, Dr. Chen, and thanks to all of you.
Thank you so much.
Bye-bye.